Thank you very much. And as an educator, I'm a college president of a university that includes nursing, nurse practitioners, and doctoral level nurses. And I'm going to take this back to my fellow college presidents and see what we can do, at least in this country and working overseas. I want to do sort of a quick summary of what I'm hearing, and then give Marla a chance to say a few words, and then I hope we'll have a little time, but if not, we'll be able to talk over lunch. First of all, the reality is that nurses and midwives are providing services beyond that is authorized. I like that statement. As an anthropologist, I can tell you that is absolutely true. And so we already have for-profit enterprise. We already have a private sector. So I think all of the conversation today about the public-private partnerships has been very important. But it's also very clear that there needs to be consideration of policy changes. And I think one of the questions I asked myself as I listened is, are we talking about changing from the ground up, which were some of the conversations we had today, or from the top down, the government levels and the big international agencies and donors? And the reality is, I think today's conversation said we have to do both. I hope they meet in the middle. Hope they don't just go right past each other, but I think as we have this conversation, we have to keep in mind that we're really working sort of from every direction possible. And I think a good example of the public and private partnerships, rather than having these really firewalls between them, which had occurred for so long, is the One Family Health in Rwanda. And we need to be able to talk about these examples, replicate them, share them, and so that's been very helpful. Also, as Ambassador Simon noted, we need to be able to do both the public-private, and we need to work both in education and in practice, and ideally to be doing those together. And your comment about nurses partnering with doctors, I mean, again, all over the world this is an issue. Nurses, midwives, and actually community health workers, other levels of health practitioners need to be able to partner with doctors. And that means really radical change, as you've also commented, and that was what we tried to do in the Lancet report on the health professions for the 21st century, was to really push that change, and we are working to push it around the world. The other area I thought was really important in the comments today that came up over and over again was the interrelationship of sectors. And Marla and her fellow workshop participants talk about development, health, social, empowering women, improving lives and communities, really the fact that you don't separate these things out, but they all integrate. And it takes me back to that long conversation we've had about vertical versus integrated systems in healthcare delivery, which has been going on as long as I've been in the field, which is a long time. And so that has also been really important and needs also policy changes by governments, by funding organizations, both at the national level and at the global level. So again, a lot of questions that for me emerge from this discussion is how we take it to this next level of influencing those policymakers. In particular, I think the funding agencies and the foundations are ahead of us on some of this and are listening. I really find the role of private investment exciting. And I like that concept, the funding model that rewards performance, but just everything we're hearing today about private investment is very encouraging. And also, we talked about reverse innovations, but I want to remind us to look at our history. We have several pioneers in the room. I would count you off among them, but Ruth Lubick and her work that she did in New York City with midwifery and with birthing centers. Let's remember some of our history in this. Let's remember our history of nursing in Appalachia and everything that is happening today with nurses and midwives. And I will confess that my midwife was not only a wonderful person, but her name was Sharon Robinson, and her father was Jackie Robinson. So I felt like I had a double distinction. I had a midwife and a very interesting woman, and we've remained in touch. And by the way, 37 years ago, having a midwife in California was very radical, even in California. And then also the whole idea that it's been happening in this country for the same reason it's been happening in other countries. It had to, and that is the increasing role of nurse practitioners. And in many states, the ability of nurse practitioners to be able to practice independently. So my sister-in-law has an independent solo practice as a psychiatric nurse practitioner in rural New Hampshire. And people come from miles and miles to be her patients. And this is a story in the U.S., not just in Africa. We need it in the U.S., not just in Africa. So I think that's something we can talk about sharing and learning, particularly from our examples from the rest of the world. And then I began with a story, I'll end with a story. I remember, and it was a while ago, it was in the 70s, and I was working, I think it was a USAID-funded project actually, in Haiti, and we were working with midwives in rural Haiti, and working with midwife education, and particularly helping to link midwives to the national health system, helping midwives and also traditional healers understand when to make that link, when to make that connection, triaging. And I was in a little village called La Cadette that was a 4-hour journey from the capital of Port-au-Prince. And that 4-hour journey included walking for a couple of hours. So if a woman was having trouble in labor, she had to be carried in a chair for several hours. And then you would get to a village called Tomazo, and then you would have a very rough road, and then you'd have a little bit of smooth road before you got to the hospital in Port-au-Prince. And by the way, the distance was 22 miles. So this is the kind of situation that we face. And without those matrons, without those midwives in the little village in Haiti, more women than did would have died in childbirth, would not have had the prenatal care they needed. And so I think about those women in that community as we have the conversations we're having today. So I'd like, Marla, to ask you to comment briefly, and then I hope we can have a little bit of discussion before we go to lunch.